Hey, everybody, and welcome to the 2021 Employee Benefits Meeting. As is fitting for this year, we're doing it virtual. So Michelle and I are going to play Hollywood Squares. It may look like that a little bit, and we're going to walk through the presentation on all of the insurance products and then the wellness program. Here's the great news. Nothing changed. We kept our current vendor lineup, so we kept everything with Humana, and the prices didn't increase. Yay! So we're really excited about the offering this year, and that's what we're going to talk through. So a couple of things right as we get started. We're going to be talking about medical, supplemental plans, dental, vision, life insurance. All of those are COBRA eligible. That's what that means, meaning you can take it with you and pay for it if you want to. Bottom of this page simply means unless you have one of these bullet points going on in your life in the middle of the year, you can't change whatever election you choose during open enrollment. So open enrollment is until December the 11th. Please turn all of your forms in. We'll show you what those forms are going to look like by December 11th, but whatever you choose during open enrollment stays in place unless you have one of these qualifying life events that are listed out on those bullet points there. I'm going to go over pretty quickly the next couple of plans. We stayed with Humana. We've got plan A, B, C, and D. Plan A is the high deductible health plan. So it's called a high deductible health plan because it's got a high deductible, $4,500. Everything goes towards that. And you've got a $6,350 per year out of pocket. So in other words, I went to a doctor recently and had to get some amoxicillin, and I got the discounted rate by staying in the network for the doctor and the RX, and that went towards my out-of-pocket maximum and my deductible. The next plan that we have is Plan B. And that doesn't mean it's a bad plan, like Plan A is a really good plan and Plan B only works out unless Plan A doesn't. It's just the second plan. So this is a copay plan. In fact, the next three plans are copay plans. And by copays, I just mean you're going to pay a copay when you go to the doctor. You're going to go pay a copay when you get a prescription drug. So none of this information changed. You've got copays for primary care and specialist. I did fail to mention, my bad, that you've got a $49 copay for virtual visits on that HSA. So that's a pretty cool deal. You got a $40 copay for Plan B. You've got some copays for ER and urgent care. You have a lower deductible on Plan B. You have these copays for when you get a prescription. And then interestingly enough, you've got a little more out-of-pocket maximum exposure. So when you go into the hospital is when you're going to meet your deductible or your out-of-pocket maximum. Otherwise, you're going to be paying copays for services that you need. And so what you'll see on these final two plans is you'll see that copays and premiums and out-of-pocket max and deductibles all kind of go like that. So you've got a $35 or $50 copay for office visits, 20 or 35 on the fourth most expensive plan. And then the copays are going to be lower the more we go to the right. So $20 copay for retail and virtual, $35 for retail and virtual here. Deductible is $2,500 on Plan C. It's $1,500 on Plan D. Still got those same copays for ER and urgent care. And you've got your prescription drug tiers listed right here. You've got a $6,500 out-of-pocket maximum. So when I think about insurance, you've got three plans, Plan A, B, and C, that have almost the exact same out-of-pocket maximum. So it really is about the exposure underneath the out-of-pocket maximum and how much you want coming out of your paycheck for the services provided. Now, Plan D has the lowest out-of-pocket maximum of $3,000. So that's the reason why it is the most expensive. And what you'll see here, this is a very busy, colorful page. You'll see medical contributions for amounts based on hourly pay. So there are going to be a couple of different slides. This didn't change from last year, and it's based on where you are in terms of the wellness plan called Go 365. That's what Michelle is going to spend a couple of minutes talking about, but these plans are the same as last year. So if your hourly rate falls between $8.15 and $8.99, then you have these rates depending on where you are in the wellness program. And you'll see the rates go up because there's either richer copays or lower deductibles, out-of-pocket maximums, things like that, as we go down on the page, which was going to the right in the presentation. Now, the difference between that page and this page is just hourly rates. It's just wages. So this is the $9 to roughly $20, $19.99. So you'll see those rates there. And again, those are the same as they were last year. And this page is $20 plus. So you'll see these rates here as well. Now, the last page that I'm going to speak to before we start talking about your teeth, your eyes, and your life is this page right here. So call 911. That was new in like 1970, but we want you to know it's still there. If you have an emergency, call them. The biggest piece of information on this page is this freestanding emergency room versus hospital emergency room. No matter which market you're in Texas, no matter which city you're in, you're going to have developers putting emergency rooms outside of a hospital setting, and they're putting them in the same facility sometimes as that freestanding emergency room. And so what you want to be very, very cautious of is walking into the wrong door. Unless it's life or limb threatening, stay out of the emergency room. You've got copays no matter which plan you're on Doctor on Demand, which is a pretty cool feature. So even on that HSA plan, it's $49 or less. And depending on which copay plan you choose, it is a lower fee. Michelle's going to talk about the next couple of pages because we've been invested in Go 365 at Thank You Nurses for a couple of years, Michelle, and you're our go-to here. So what do we need to know about these next couple of pages so that we make sure that all of our folks get as much of a discount as soon as they can as possible?
Yes. So in general, Go 365 is the rewards program that comes with your medical Humana insurance. So as long as you're covered with Humana Medical, then you can participate in this program. And what I like about it is that it's a rewards program, but really you're earning the rewards two ways. So there are built-in incentives. Every time you get points, you get bucks. So you cash out those bucks. I think just about a couple of weeks ago, I cashed in about $100 to Best Buy and bought myself a cool little waterproof Bluetooth portable speaker. So that's been my newest purchase. So that's the one I want to be talking about in all these meetings. But beyond that, there's lots of good stuff. Amazon, Lowe's, Macy's, Target, were the usual that y'all are probably familiar with. A couple of months ago, Go 365 actually expanded their rewards mall. So now you have restaurant gift cards, movie theater gift cards. I think before it was just Fandango. Now there's a couple of different options. Bikes are in there. There's also Fitbit devices, Garmin devices. So tons of things. I like to spend my bucks on me, but if you are a little bit more charitable, especially around this time of year, and this year, right, we've all experienced a lot. There's also ways that you can donate those bucks too. So lots of good ways to earn for yourself or anybody else. But not only are you earning rewards, you're also earning lower premiums. And that's what Ben went over in those last couple of pages, is those different tiers of premiums. Many of you all right now are experiencing and paying those lower premiums, so good job. My role, along with Lucky too, really is to make sure that y'all continue to pay lower premiums, especially going into the new program year. And so your medical starts over January 1st. Now keep in mind that Go 365 is a little bit different. For you all, it actually starts over March 1st. The good news about that is that, you know, starting today, really, you all can continue to engage in Go 365, earn those points, continue to earn now, and maybe even have the potential to earn a higher premium savings rolling into that March 1st Go 365 program year. So keep on going. I know it's been a tough year. I've been not as good as the previous year, so it happens, that's fine. But just remember that you can earn lower premium amounts just by engaging. Okay, and so what I'm going to do is after this call, I'm going to run a report and I'm actually going to send some information to Letty there's a couple of people who need to gauge just a little bit more to make sure that y'all lock in your premiums going into that next program year. And so this page that Ben is on, it goes over the next items that you all want to do really in March. Now, if you haven't done them this program year, still do them. Do them right now before March comes around. If you've done these things that I'm going to talk about, sit tight for now, keep on engaging, keep on getting those fitness points, and keep on doing what you're doing. But this you'll focus on come March 1st. I'll send some reminder emails too, so don't feel that you have to remember this between now and March. But you definitely want to register, get signed up if you aren't already. On number 2, click activities and complete all sections of the health assessment. So the health assessment is that online easy lifestyle questionnaire. You can do it on the app or on the website. But things about, what do you eat? What do you drink? Do you work out? If so, what kind of workouts? This is something that has to be completed every single year. So even if you've done it, you're going to want to do it again come March. And if you haven't done it this year, then go ahead and do it before March. Number 3, I'm sure y'all are familiar with this. If you have completed the health assessment, it's receiving your Go 365 age. I'm going to warn you, most people are older per their Go 365 age than what they are in real life, and that's okay. This program really does have those incentives, those tools to help you change that number and reward you at the same time. So don't worry about that. Don't freak out. And then number 4, keep earning points by completing healthy activities. You'll see that first bullet right there says biometric screening. I'm going to send that to Letty too. There are some ways, if you haven't completed it this year, there are some ways that you can actually get a home test kit that goes straight to you. It's free, it's convenient. If you have completed it this year, then come March, we'll be communicating the ways that you can do it then, so you can keep on doing it. But other things, flu shots, preventive exams are my favorite ways to get points. Those free dental visits, twice a year, vision once a year, blood donations, CPR first aid certifications. So lots of ways to earn points within the program. And then of course, number 5, don't forget, I don't know how many times people have said, what are these bucks? Like, what do you mean, what are these bucks? Don't forget about those bucks. The good thing about the bucks though is that they do roll over. So you have up to 2 years to spend those bucks. Don't feel the need to spend them quickly. I know myself, they burn a hole in my pocket, but if you like to sit on your bucks and let them pile up, by all means do so. Just make sure to spend them within 2 years, and you will get a notification if you do have any bucks that are expiring. Okay, let's scroll a little, Ben. Let's see what else we have. So this page goes over the biometric screening, the points. That first column right there are the points and bucks that you earn simply by completing it. Just by showing up, you'll get 2,000 points, which is about the equivalent of $20. Now on that right-hand column, you'll see the potential points that you can earn if you have any of those 4 metrics in range: BMI, glucose, blood pressure, total cholesterol. So you have the potential to earn anywhere between $20 to $40 just with this this event. Again, if you haven't completed it this year, I'll send some information to Letty. I know she's been communicating that earlier this year, but just a reminder of ways that you can complete this still within this year. All right, let's keep on.
What can I ask you a question real quick?
Yeah.
What are folks supposed to do when it's hard to actually get in physically to places right now? Is there another option to do that?
There is, and it's one that I did this year, and it's one of my favorite that I'm promoting this year specifically because of problems like that. But there is an at-home test kit. And so there's a link. All you have to do is, it almost looks like you're ordering something. You put the home test kit in your cart, you go through checkout, but it's free. Now there is the potential you can pay extra to get the nicotine swabs. So that will be the only thing that you do pay for. But other than that, if you just do the home test kit, it gets shipped directly to you. What I like about it is it's just a little finger prick. So you poke the finger yourself, send off a little bit of blood, and that's all you have to do. Within a couple of weeks, those The sample is going to be tested. Those results are going to come in, and this vendor is going to submit to Go365 those results. So that's all you have to do. Order it. When it gets there, give a little bit of blood, and then you'll get those points. So there is an option if you prefer to stay home, or if you just can't get into a clinic right now. That is a good question. Okay, let's see what else we have. So this page is important if you have anybody other than yourself on your plan. So you'll see these little, I guess a little stair step under silver, gold, and platinum. There's 3 different rows of points. If you're employee only, you're going to stick to that top row with 5, 8, or 10,000 points, because that's how many points it's going to take you as an employee only to earn silver, gold, or platinum. Now you'll start to look into those second rows only if you have an adult on the plan. So this adult could either be a spouse or a child that is 18 years and older. So if you have 2 adults on the plan, again, this is you and a spouse, or you and a child that's over 18, you're going to go to that second row, and that's the amount of points it takes to get to each of those statuses. Now, if you have an additional adult past 2, including you, that's where you start to add either 3, 4, or 5,000 per adult. So doing some quick math, if it's you, a spouse, and a 19-year-old child on the plan, total to get to silver, it's going to take you all 11,000 points to earn as a unit, though. So if you do have anybody on the plan aside from you, make sure that they're doing the same things that I'm recommending for you all to do. If they're over the age of 18, they are going to have to register, but they're going to do the same things that you're doing to help engage. Okay, and let's go to the last page. I like this last page because it just gives some different combinations. It's a little bit cheesy, but I like to say everybody's road to silver, gold, and platinum really is dependent on that person. And so this is a good example of a couple of ways that both an individual and a family with 2 adults and a child under the age of 18 got to silver, because there are different ways. Those points are going to add up differently for everybody. And these are just 2 examples of how 2 scenarios of getting to silver. But I think that's it. I guess to kind of sum it up, I'm reading my notes to make sure I got it all. Keep engaging now, whether you're at silver, gold, or platinum, because you have until the end of February to engage. So whatever you're doing, keep engaging now. There is still time. If you sign onto your Go365 app and you say, oh my gosh, I haven't done anything this year, again, you're not alone, but you still have time. So you want to get in gear before March 1st, and that means completing the health assessment and the biometric screening, and do make sure that you have some kind of, I like to say, start with your phone. If you have a Samsung or an Android, Samsung Health is a free app. If you have an iPhone, Apple Health is a free app. You want to make sure that those things are connected to your Go365, because you're accumulating points every day simply by having your phone on you. So I'd say those are the 3 major things to focus on now if you haven't. And again, come March 1st, whether you're engaging or not, those are going to be the 3 things: health assessment, biometric screening, and fitness device. And again, I'll send some information to Letty just to have it sent to you all when it's fresh again, since we're talking about Go365 again. Some things that you can do in the meantime to make sure that you're just giving yourself the best opportunity to earn rewards, but also lower those premiums every month. I think I got it all. Anything else that I should add, Ben?
No, just one anecdotal comment. I want to know what I bought with my Go365 recently.
What'd you get?
I bought 2 hats with
Oh.
a Bigfoot on them. One is
Oh,
one is Sasquatch walking a dog,
okay.
and another one is just has Sasquatch, and it's got a little button on it and says legendary. With
That's so. Now, where did you get those from?
Oh, you got to go deep in a weird internet world full of Bigfoot and Sasquatch. That's a totally other, non-recorded version, having nothing to do with influence. But I love Bigfoot, so I got some hats with Bigfoot on it. So you can get anything you want on the internet, as long as Amazon delivers it.
Yes.
Not having anything to do with fictional or not creatures, we do have that HSA account that is attached to Plan A. So that this is a bank account in your name. You put your money into this account. If you leave employment with Thank You Nurses, that money goes with you. If you spend the money on anything medical or dental or vision related, the money's not there. If you don't, and you continue to add to it, just like any other bank account, it builds up over time. It's not, the money going in is not taxed. And so that's one of the reasons why I like an HSA is I don't pay tax on the money that I put into my account. But the trade-off for having an HSA account is you don't pay copays for stuff like going to see the doctor or getting a prescription. Okay, more information on an HSA, basically just details some tax impact. Dental, same plan, rates are right here at the bottom. We're still with Humana. The cool thing about this plan is it does have an unlimited annual maximum, which most plans we have like $1,000 total that they will pay for covered services. So this does not have an annual maximum, which is pretty cool. You only have a $50 deductible per year, which means the first 50 bucks is on you. Teeth cleanings, Michelle mentioned those tie right into Go 365. You go get that done twice per year and it automatically syncs and you get points. And then if you need covered services, then basically you're paying co-insurance. Co-insurance is just the split between you and the insurance company. So you're paying 20 cents on the dollar for basic services and then 50 cents on the dollar for major services. If you've got orthodontia needs, you do have a limitation on there, and everybody knows braces cost more than $1,000. So I know that too. I've got 3 kids, or at least I did when I left the house, and 2 of the 3 need braces. So I get how expensive those can be. Here's the vision plan. This sometimes confuses people. So when you go to your eye doctor, they're going to care about iMed Insight. That's who is in the network. They're going to say, what network are you in? If you say Humana, they'll go, what network? So you'll say iMed Insight. So you'll walk in and you'll pay them 10 bucks for the right to walk in the door and say, thank you for letting me in. And then you'll get 160 bucks for some cool guy or cool girl frames. And then you get a percentage, 20% off the balance over that. And then you got lenses on a copay. If you're really blind like me, you're not getting out for $10 copay. I got to shrink them down and do a bunch of stuff to them. So the better your vision, the more likely you are to actually get out for a copay on your lenses. The worse your vision, and if you have to shrink them down, you're not getting out for a copay. I have a plan that's very similar to this. I'm not getting out for a copay either. Contact lenses, you get 160 bucks. So the way that you think about this once every is you get either glasses, you get an allowance. You can't spend your allowance twice. You either get it for glasses and frames or contact lenses, not both at the same time. That's what that once every means. Prices are here at the bottom, pretty inexpensive little policy here. And then we've got some life insurance. So we've got $15,000, very, very inexpensive here. And then you've got spouse and kiddo coverage. So we're going to show you an enrollment form before we get done that you can elect this coverage if you so choose. But if you do, you got to tell us who, if you're no longer living, where the proceeds go. That's called your beneficiary, and that's why it has that red feature right there. EAP is free to you, paid for by the company, included in the policies here. If you'd like to know more about what the EAP responds, just for sake of being as brief as we can, because this is a recorded webinar, it's all here on this page and the next page. Okay, the majority of the 56 pages of glory in this booklet is taken up by our friends at Colonial. This is a good thing. There's lots of stuff that's available to you. It can get super confusing. Because we like you, I'm going to stick on this page and say, if you have any questions, call someone else. How about that? Call Colonial. They're great people. Kelly is who we work with over there, and she'll be able to assist you with any question that you have. These rates are locked, and so those don't change over time. And so you've got a bunch of different products. Individual disability, get hurt or sick, that's what disability is. It insures a percentage of your paycheck. Accident, money comes to your mailbox if you or somebody you're covering gets into an accident, car accident, breaking a leg, getting a laceration, hurting yourself. Cancer is if, God forbid, you get that diagnosis. There's different benefit amounts that show up in your mailbox. Medical bridge covers monies underneath your deductible. So on your medical plans, you've got kind of this donut hole between your deductible and then your out-of-pocket maximum, you're responsible for the money underneath your deductible. So a medical bridge assists with the monies underneath that deductible. It's just a lump sum benefit that's sent to your mailbox. Critical illness has illnesses that would be like heart attack, stroke type policies. We have all the information in this guide. Term life means life insurance for a specific term. Whole life means life insurance for a non-specific term or until you die. It's more expensive, but there is no term or fixed period of time for which the life insurance responds. So term is good if you're just looking to insure against the risk of death, like before your kids go to college, for example. So that's a pretty good reason why people buy term insurance. Whole life is insuring for a lot longer than just a 15 or 20 or 30-year term. Okay, now you can close your eyes real tight because it's going to get, it's going to be like a roller coaster here. I'm going to go through all of that, all of the information I'm scrolling through. I just summarized. It's quite a bit of information. I'll tell you, we want to be thorough. And so there's a lot more for follow-up. If you have any questions, please let us or Colonial know. And some of those questions do really get pretty specific. Well, last year I was diagnosed with this, and would this policy respond if we just got to tackle some of those questions in a pretty personal way. Or what would it cover if I broke my arm in 4 places instead of 2? Well, we can get you that that information. It's got that accident policy. I have one like that for my daughter. And so when she fell and broke her arm, after I confirmed that she was okay, I got a little bit of money that came to my mailbox. Now I use that, you can use that money for whatever you want. And don't go home saying that guy at work said injure small children just for an insurance payout. That is not what I'm saying. I'm just saying after my sweet little girl, I found out she was fine. I'm like, I'm gonna get a little bit of money out of this. It was nice. It was nice. Okay. I just scrolled through a ton of information, and now I'm going to scroll through a ton of other information. These are required notices. We have to let you know this stuff is in play. We're not going to cover them for the sake of time. It's great late night reading material as far as I'm concerned, but you're going to get really dizzy, and I am scrolling to a specific page, which will end on here in just a second, which is this one. All of your vendor lineup, please turn in your forms. By December 11th, contact Christopher or Jenny at Catto. If it's wellness specific, then a lot of y'all already have Michelle's contact information. Jenny can route your question to her. But that concludes the meeting. Thanks for hanging on with us today, and hope y'all are well and safe, and look forward to seeing you. Actually, not on a recorded Zoom video, but face to face as soon as possible. Thanks, y'all. Take care. Bye-bye.